In this program, we are going to look at bipolar disorders and the medications used to treat them. After viewing this program, you should be able to discuss the basic signs, symptoms, and physiology of bipolar disorders, understand the major types of psychotropic medications used in treatment for this mental disorder, discuss theories of how these medications work within the brain, verbalize assessment of the patient with bipolar disorders, and discuss side effects of the psychotropic medications used in the treatment of bipolar disorders.
Mark, look. Aren't these gorgeous? I found the best sale downtown. Don't you just love these? And you don't have to worry about the money. I got them because I know I'm going to win the lottery. I bought 20 tickets.
Tish, what's going on?
What's going on? We're going to win the lottery tonight. I bought 20 tickets. Everything's wonderful.
I don't think everything's wonderful.
But it is. Mark, what are you talking about?
The lottery tickets and the dresses, I think we ought to give Dr. Sagely a call.
Dr. Sagely? I don't need Dr. Sagely. You take them back.
Bipolar disorders are an extremely painful illness. These people experience mood swings that can be just devastating to their lives. It's not unusual for a patient with a bipolar disorder to enter the hospital and be up for several days. They can't sleep, they can't eat, they can't stop talking. And then the other side of that is when they're depressed, they can barely move. So it's an extremely damaging and devastating illness.
The lows you dread and the highs you dread after a while, because on the lows, all you want to do is sleep. And on the highs, the only thing you don't want to do is sleep.
Mood disorders are challenging to diagnose and treat and constitute a significant health issue. They include bipolar disorders and major depression, with or without psychotic features. Mood disorders constitute a major health issue. By some estimates, these disorders may affect up to 7% of the U.S. population. Approximately 0.4 to 1.6% of the adult population is affected with bipolar disorders. Antidepressants, mood stabilizers, and atypical antipsychotics are the primary treatments for these disorders.
Happy days are here again. Your mom's made super snacks again. So sing a song of cheer again. Snooper snacks are here again.
Bipolar disorders are a type of mood disorder and may be referred to as manic depression or manic depressive disorder. It is marked by severe mood swings between depression and elation and by remission and recurrence.
You're getting that way again.
What way?
Like when you were sick?
You know, Sean, sometimes you're just like your dad.
Some people can have these changes numerous times a day or week, and others may have long periods of being either in a manic state or a depressed mood, followed by light periods of the opposite behavior. In severe forms, these patients can become psychotic as well. The DSM-4-TR, the Diagnostic and Statistical Manual of Mental Disorders, describes two types of bipolar disorders. Bipolar 1 is marked by one or more manic episodes and one or more major depressive episodes. Bipolar 2 is marked by one or more depressive episodes, along with at least one episode of hypomania. This is a milder form of mania. This bipolar 2 diagnosis would not be applied to an individual who has ever had full manic episodes. Several theories have been proposed to account for the underlying cause of bipolar disorders, though to date no single cause has been determined. Scientists are exploring the possibility of specific gene involvement in the development of bipolar disorders. Also, brain imaging studies are helping us to gain an understanding of the structure and activity of the brain, which may help to predict which types of treatment will work most effectively. Comorbid problems common in patients with bipolar disorders include polysubstance dependence and abuse, obsessive-compulsive disorder, migraine, impulse control disorder, panic disorder, and bulimia.
Bipolar patients have a real problem with compliance because they tend to enjoy the state of being hypomanic, which is not quite manic where you're not in touch with reality, but you feel elated, you feel powerful, you feel energetic, you feel brilliant. It's hard to tell these patients this is a disorder and you need to be less of these things. So a lot of times compliance with bipolar patients becomes tricky because you want to give them enough medication where they're not making impulsive decisions and snap judgments, but not so much that they feel down in the dumps and no longer feel bright and energetic.
So Tish, how you doing today?
I'm tired.
You're tired.
I'm tired all the time.
Well, that is a common complaint and it's a common side effect. We start you with one dose, then we take your blood levels, see where you're at, and then we'll adjust the medication. We need you to take your medication as prescribed and agree that you're going to work with us to get you there. Can I count on you?
Sure. I don't want things to be like they were before.
Mm-hmm. The mainstay in the treatment of bipolar disorders has been lithium. It impacts the nervous system in many ways, including the release of norepinephrine and serotonin and regulation of the action of neurotransmitter receptors. Despite its effectiveness as an anti-manic and antidepressant, lithium's mechanisms are not well understood. Lithium is a metal mined from the ground and combined with carbonate to make a salt. It is eliminated from the body almost exclusively by the kidneys. In overdose, or in the event of decreased kidney function, lithium can be very toxic, even fatal. Therefore, it is important to monitor renal function. Nausea and vomiting are not unusual when the liquid and straight lithium carbonate forms are used. These symptoms can also be signs of an evolving toxic state secondary to elevated lithium levels. In patients exhibiting nausea and vomiting, a lithium blood level should be obtained to rule out toxicity. Longer-term potential side effects of lithium include hypothyroidism as well as kidney damage. Accordingly, blood tests should be periodically obtained to assess the functional status of these organs. Early side effects of lithium include nausea, diarrhea, polydipsia, which is increased thirst, polyuria, or increased urination, anorexia, and abdominal pain. If nausea is significant, patients should take lithium after a meal or snack. Other approaches to decrease nausea include giving a smaller dose more frequently or by switching to an extended release form of lithium. Time-release products can help lower the incidence of side effects, or at least their impact, because they tend to have lower peak serum levels.
And lithium took away my manic highs, which I objected to, because I kind of enjoyed that part. I didn't want to be depressed, but I liked having that tremendous amount of energy, It was kind of like a very interesting thing that I have so much energy and in every area of my life.
One of the things that we know about lithium is that it makes other drugs more potent. The thing I've always thought was very important is to recognize that because lithium is an enhancer, it probably enhances the effectiveness of many other drugs used for other purposes besides psychiatric illness. And every physician and nurse should be aware of the fact that their patient on lithium may have an enhancement of the effect of other medications.
The optimal dosage of lithium varies by individual and may even vary over time. Regular blood tests as well as evaluation are required to monitor the impact and effectiveness of the medication. Although lithium has been considered the drug of choice for bipolar disorders, anticonvulsants are now also being used as first-line mood stabilizers. Divalproex sodium, Depakote, is FDA approved for the treatment of acute mania. Other anticonvulsants, which are now considered an alternative non-FDA approved treatment in bipolar disorders, are carbamazepine, Tegretol, lamotrigine, Lamictal, and topiramate, Topamax. In the treatment of mood disorders, the precise mechanism of the anticonvulsants remains unclear. Anticonvulsant medications are central nervous system depressants. They seem to exert their influence in mental illness by slowing down and stabilizing the release of certain neurotransmitters. This process is not immediate. It might take days or weeks for anticonvulsant medications to have an impact on such an unstable nervous system. When anticonvulsants are used, liver function tests and drug serum level monitoring is recommended. This is done for several reasons. It helps to determine whether the patient is taking the medication and whether blood levels are adequate. Testing also monitors for drug accumulation in the system, as well as any deleterious impact on the system's liver and kidney function. Patients with a compromised hepatic system, including damage from hepatitis or alcohol abuse, may not be able to take anticonvulsants. In these patients, liver enzymes must be carefully monitored for evidence of liver damage. There are, of course, side effects with the use of anticonvulsants. These products are all central nervous system depressants, and sedation is commonly seen. Changes in blood pressure, usually lower, are common. Balance and speech patterns may also become affected. The development of tremor, excessive sedation, or nystagmus, which is a distinctive rhythmic movement of the eyes, may be the warning signs that the medication serum level is excessive. Usually nystagmus is associated with carbamazepine toxicity. Excessive sedation may be a warning sign for all of the anticonvulsants that the dose is approaching the upper limit. In many cases, drug side effects can be lessened by adjusting the dosing administration times, the use of extended-release products, or by taking the medication with food. Symbyax has received FDA approval for treatment of bipolar depression. It is a combination of the antidepressant fluoxetine, Prozac, and the antipsychotic olanzapine, Zyprexa. The medication treats the depression stages of the illness without triggering mania. Side effects may include somnolence, weakness, edema, weight gain, and increased appetite. Also, the following atypical antipsychotics have been approved for the treatment of acute bipolar disorder: risperidone, Risperdal, olanzapine, Zyprexa, zyprasidone, Geodone, and quetiapine, Seroquel. Antidepressants may be added to lithium treatment while the patient is in the depressive phase. Antidepressants are indicated only if mood stabilizers have failed to adequately control the depressed phase and may cause bipolar cycle acceleration.
You know, Mark, it's kind of hard to let go of the highs. They sort of felt good in a way, but after all the destruction it caused in our life, I'm really glad that you and Sean have pointed everything out to me and stood by me.
We want to continue to help you.
And I appreciate that. I love you both and Stacy so much. Everything's going to be okay.